Please welcome Brian Wilkinson, Regional Sales Manager, Mid-Atlantic Steelcase Incorporated.
Hello, good afternoon. My name is Brian Wilkinson. I'm Regional Manager for Steelcase here in Washington, D.C., as well as in our Mid-Atlantic region. Steelcase is the leading manufacturer globally of furniture for offices, hospitals, and classrooms, and the sponsor of this Master Series session. And it's my pleasure to welcome you here today. So before we begin, I wanted to start with a question for everyone in a room that applies to what we're about to hear from our guest speaker. What if we designed environments that enabled everyone to thrive, no matter who they were, where they lived, or what their occupation? I think that's something we can all rally around and be passionate about. Like the speaker we're about to hear from, Dr. Donald Schwarz, and like the Robert Wood Johnson Foundation that he represents, Steelcase is focused on helping people be their best. In fact, our company's stated purpose is to unlock human promise, and for us, sustainability is core to our business and to our values. It means creating the social, economic, and environmental conditions that allow people to thrive. Like Dr. Schwarz, we also recognize that people's health and well-being are interconnected to many environmental and social factors outside of just traditional healthcare. Where and how people live, learn, work, and play is profoundly important. At Steelcase, our capabilities extend to corporate, healthcare, education, and distributed work environments. In essence, wherever work happens. Our strategy is to leverage our deep understanding of the changing nature of work, workers, and the workplace to design solutions that inspire and support great work. And at a fundamental level, that's about supporting people's well-being. Through our research, partnerships, and working closely with our customers, many of whom are represented in this audience today, we continue to gain insights into how spaces impact people's physical, cognitive, and emotional well-being. So what does that mean? In terms of physical well-being, for decades, Steelcase has been a leader in comprehensive materials chemistry assessments, eliminating and phasing out materials of concern from our products, and developing sustainable alternatives. We've also taken a leadership role in developing products that encourage healthy movement and posture changes throughout the workday. An example is our highly ergonomic gesture task chair that mimics and mirrors the natural motion of the body. Another example is our walk station, which is a treadmill desk that was developed in collaboration with the Mayo Clinic and allows you to stand and accomplish tasks that you normally do while sitting. However, as proud as we are of breakthroughs like these, we also know that health is more than just physical well-being. People are at their best when all their needs are met. This includes supporting cognitive well-being, making it easier for people to think better at work. Our newest product innovations draw from the latest neuroscience findings about attention, creativity, mindfulness, and other key brain activities we go through every day. In addition, more than ever, meeting people's needs at work also requires supporting their emotional well-being. Today, disengaged employees outnumber their engaged counterparts by nearly 2 to 1. A recent Gallup study just completed found that 87% of the global workforce is either disengaged or actively disengaged. Our research tells us that physical space powerfully affects how people feel. A study recently completed in 17 different countries by Steelcase showed that high workplace satisfaction positively correlates with high employee engagement around the world. And the reverse is true as well. Employees who hate their offices, learning, and healing environments are also highly disengaged. In addition to negatively affecting the quality of their work and the organization's bottom line, that's also bad for their personal health and well-being at work, at home, and in their communities. So, while changing the workplace alone is not enough to combat the issues of stress, burnout, and disengagement, we know it can be an important part of the solution. So back to the original question. What if we designed environments that enabled everyone to thrive, no matter who they were, where they lived, or what their occupation? Like Dr. Schwarz, his organization, and so many of you who are attending this event, at Steelcase, we're driving towards a broad spectrum of impact by involving ourselves deeply in the important issues and opportunities of our time. That's what brings us together at Greenbuild, and that's why Steelcase is so proud to sponsor this session. Thank you very much for being here.
Hi. Happy Greenbuild, everybody. Are you having a good day so far? Awesome. I'm so glad to hear it. How many of you were here last year when we had the Acting Surgeon General Boris Lushniak here? Walking with all that great physical energy? Yeah, great. He was recruiting us, the Green Building Movement, into his cause of medicine, right? Today, we have another call to action. Are you ready? Come on, people. I know it's just after lunch. Right, thank you. Dr. Donald Schwarz is here with us from the Robert Wood Johnson Foundation. That's the largest sponsor of health-related research in the United States at $9.2 billion they're investing in this. And that's why? To build a culture of health. And we're very thankful that 1.2 million of those dollars are invested with the USGBC. So thank you in advance to Dr. Schwarz. Dr. Schwarz and the Robert Wood Johnson Foundation understand how the green movement in real estate and the property sector is both a model for how to make people healthier at scale and a source of immediate intervention in the health of individuals. That goes back to the work that you all are doing to design healthier spaces every day. So people, Dr. Schwarz is here to recruit us to a culture of health. Since we know that health is as much a matter of zip code as a ton of other factors, and we're the Green Building Movement. We can help with this, right? We're here to help break down those patterns of settlement issues and provide access to health to all Americans. And what a leader and an ally we have in Dr. Schwarz. With an MD and a Master in Public Health from Johns Hopkins, an MBA in Healthcare Administration from Wharton. He was the Vice Chair of the Pediatrics Department at the University of Pennsylvania School of Medicine. He was the Health Commissioner for the City of Philadelphia on the front lines of challenging populations and succeeding in making an impact. So under his leadership, Philadelphia saw a 5% reduction in childhood obesity and a decline in adult obesity rates overall, more than a 50% increase in permanent housing for the homeless, for individuals and families, and a 24% reduction in the rate of dependent children being removed from their families. Under his leadership, access to behavioral health system, including Medicaid, increased, and the number of those folks that had serious mental illnesses who moved to independent and community-based living increased substantially. So, my colleagues, Dr. Schwarz is in the firmament of public health leadership, and it is an honor to have him here with us today at Greenbuild, appreciating the relevance of the green building movement, and our challenge is to step up and prove it in a big way. So please join me in a commitment to creating a culture of health and in welcoming Dr. Donald Schwarz.
Good afternoon, everybody. Happy Greenbuild. I am here from the Robert Wood Johnson Foundation, as you've heard, and I'd like to introduce the foundation. We are the fourth largest U.S. foundation and the largest foundation in this country supporting entirely health as part of our mission. Because of that, I have to tell you that I have a conflict of interest today. And that is that I am going to support the product of the Robert Wood Johnson Foundation, which is a sustainable and enduring culture of health for everyone in this country. And I am going to be shameless in promoting it, and I am going to work very hard to sell it to you. And it is something that we at the Robert Wood Johnson Foundation don't own alone, we own with you. I'm delighted to be here today. What I'd like to do is to not just introduce myself, but figure out who you are as well. And it's after lunch. How many people here, raise your hand, had lunch? Good, okay. I am a pediatrician, lunch is important. What we're going to do is a little exercise. since I have lots of lights shining on me, what we're going to do is I'm going to ask a question, and we're going to answer it for those people to whom it applies. You're going to stand up, raise your hand, and say, "That's me." Okay? No one is going to fall asleep after lunch. We're going to keep you moving. So, for all of you, how many people here are architects? Good, okay. How many people here are designers? Oh my goodness. How many people here are part of the building industry? Good. How many people here are from health care? That's me. Okay. How many people here work for government? Good. How many people bicycled here today? Yay! How many people drove here today? Come on. Okay. How many people took the metro? Good. All right. So I have a sense of who you are. There are people who didn't stand up. I know who you are. So I'm sorry not to have included your particular field, but we'll get there. You will all be included in one way or another, and hopefully by the end of this time, you'll have some sense of your various roles and how we can work together in ways that build a culture of health in this country. So, if I show you these pictures, what country do you think of? Italy, good. Notice they all have tomatoes. You all know that tomatoes come from Peru. So until 1832 or so, there were no tomatoes in Italy. They're not a deep and historic part of the Italian soul, but they have become, I would say to you, a central part of the Italian culture. And I could describe how the passion in Italy for tomatoes means that Italy has fewer large industrial farms than the United States, because tomatoes, really good tomatoes, don't transport very well. You have to grow them close to the place where you're going to eat them. And they really don't do very well with refrigeration. So if one of your major foodstuffs is anti-refrigeration, maybe you don't need as large a refrigerator. And tomatoes are often served on pasta. Pasta, what an opportunity for design and innovation. So what nation has the best fashion in the world? Yeah. And we could think about the tomato as a fruit and vegetable that is easily shared if people come, but you can't get real Italian food if you don't come to Italy to see the monuments and see the history. We could build a story that says the Italian culture, the modern Italian culture, has as a central icon the tomato. For me, that example says that if we're going to build culture, we build it from context. Things happen. If I think about other opportunities to build culture, I think that context, in fact, generally shapes culture. You all know these images. So, does the context of having available recycling and a legal system that says we should recycle and incentives for people around recycling, does that drive a culture in this country of expectation and an awareness and a growing part of our culture that says we need to think about sustainability? I think it does. Was there a culture, a fundamental, widespread American culture that drove us to recycle? Probably not. Probably it was you guys in your passion and in your advocacy and in your wisdom that said, we need visible, meaningful opportunities for people to begin to realize the importance of climate and sustainability. And all around us, we see these images, to the point where when Americans go abroad, or when Americans who are in cities that have full stream recycling go other places, it's so inbred in their expectations that we say, where's the recycling bin? And many of us get really outraged, more than just you guys. You have friends who get upset if there's no recycling opportunity. We are creating a culture of sustainability. And I believe this icon, the recycling, visibility of recycling opportunities, is part of building that culture. We have symbols now, growing numbers of streets in America around bicycling. And the bicycle movement is taking off in this country. Are we the Netherlands, where, when, during the Second World War, the Netherlands were invaded, what happened in the Netherlands? What was the worst thing the invaders could do to the Netherlands population? When someone was really out of line in the Netherlands, they took away their bicycle. No fooling. Bicycling is an inherent part of the culture in the Netherlands. And for us, as the visibility of the symbols grow, as the environment around us more and more shows us the importance of bicycling, the availability of bicycling, the norms of bicycling, we will become, I believe, a culture where bicycles are part of the American culture. But culture also impacts context. So when Hurricane Sandy hit, we had in place, culturally, an expectation that people would have ready and rapid access to a single number to move them to security and health. The 911 system didn't exist forever in this country. It's existed for a little more than 20 years. And it is inherently part of the expectations that we have. And if any of you move to a part of the country without a 911 system, you'd be outraged. If you had to figure out the number to call an ambulance, you would not be a happy person. We have built into our culture the expectation that we will be safe, and we have built context around that expectation. So culture leads context, but context leads culture. We at the Robert Wood Johnson Foundation believe that in a generation, we can build a culture of health, a sustainable belief in this country that guides all decisions that we make. And we see you as critical partners, just as you, I hope, see health as a critical set of partners, people in health. I'm not saying health care, I'm saying health, and we're going to talk about that. But we hope that this partnership between health and sustainability is both natural and one that can grow together to enrich and change the American culture. I want to talk about that today. When most people hear about health, this is what they think. We are a culture at the moment that thinks about health care. And in particular, we think about expensive health care. We think about ambulances, and we think about hospitals, and we think about technology, CAT scans, MRIs, chemotherapy, proton therapy. If it's expensive, we invest in it. And what we know is that if we look at the 17 Western nations, and we look at the United States in comparison, and we look at the rank at each age, so along the bottom you see age groups, you look at life expectancy, the United States, up until age 75 essentially, has the worst life expectancy of any of those westernized nations. And look what happens after age 75. Life expectancy compared to other places grows in this country until at age 95, We have the best life expectancy of any Western nation. It means that each of us can expect the best opportunity for a long life after most of us are dead. But we spend 50% of our healthcare budget on the last year of life. And in fact, why life expectancy is so great at 95 in this country is because we invest in hospitals and technology and ambulances and high-cost healthcare. And other countries don't to the same degree. We're investing in a slim slice of life. But what makes a difference to life expectancy before age 75? Because we certainly have all the health care we could want. Before age 75, it's about how you live life, not how you die or how your disease is managed. Before age 75, it's about where you live and how you live and what the opportunities are for a good life. And if we look at those other 16 nations, I think we could say probably that both the opportunities and the environments are more promoting of a good, healthy life, particularly in the early part before age 75. And you all know that healthcare expenditures in this country are remarkable. What people don't usually appreciate is that if we go back to 1980, while the US had the highest proportion of our gross national product spent on healthcare, with all the cost cutting and savings and scrimping that we have done since 1980, the disparity between us and everybody else has only gotten worse. We have not fundamentally changed our culture, and our culture is one of high-cost healthcare. And it has been for a long time, and it's accelerated since 1980. And unless we think about how to shift that paradigm, how to change our context, so that we are no longer a country that says high-cost healthcare is the only way, there's no stopping that upper line. Because we've had all the dialogue we can possibly have about cost containment, and you can see how well we've done. A third of our children are overweight or obese. 75% of our young adults are not eligible for military service, most of them because of either being poorly educated or unhealthy. 1 out of every 2 deaths in this country is linked to chronic disease. That's not how people die in those other 16 nations. We spend $3 trillion on healthcare. The total budget in this country, public and private, for community development is about $200 billion. We spend $3 trillion on healthcare, and with that, $227 billion in this country is wasted on lost productivity because of health. We're not getting our money's worth. So, time to stop defining health as not being sick. You guys are on the right page with me, yes? Good, okay. So, no more of this defining health as bricks, mortar, and vehicles. What really shapes health? So is it this living in a neighborhood that may be one that promotes things that are not necessarily healthy? Or this, having opportunity to eat fresh and healthy food? Is it the ability to be outdoors and biking and exercising? Or is it access to cigarettes and alcohol? We want our children to live happy and healthy lives. At the moment, if current trends continue around obesity, our children will live shorter lives than we will. And their children will live shorter lives than they will. We are on a trajectory toward less and less in terms of health. So, we want people to be able to exercise. We want people to be able to eat well. We want people to have access to good health care early in life. But good health care should be health care that promotes health, not healthcare just that talks about and works with disease. We want less disease. We want more people who, in every aspect of their lives here, have the ability to be healthy, live active and healthy, and I would say sustainable lives. So we need to change the context in this country. That's why I'm here. You are the context people. And you're the people within the built environment world who I think get context better than anybody else. You've been working on contexts probably for all of your careers, and we want you to join us. This is something called the Health Impact Pyramid. Tom Frieden, who's the current head of the US Centers for Disease Control and Prevention in Atlanta, developed it. And what it shows is that the least impactful set of interventions to promote health are things like one-on-one counseling and education. How many people here have ever had counseling or education about their health? Raise your hands. Not everyone. Did it change your behavior? Maybe. Generally not. Generally it takes repetition. Often the education is not of high quality. Quite frequently it's not based on theory, and even if it is, it takes a long time for behavior to change. It's not an efficient set of interventions. Clinical care. Clinical care has some impact on health, but nowhere near as much. It's the things at the bottom of the pyramid. The context in which we live and the socioeconomic factors that affect us. The top 3 parts of this pyramid are what healthcare services deliver. Things like immunizations, which are incredibly important on a population level, but sanitation is arguably much more impactful than even immunization in terms of promoting the health of a population. Changing the context, for instance, the food environment, removing smoke from places where people live, improving transportation, housing, jobs, and education. I hope you've all seen this map. It's a subway map for this city of Washington, and it shows what the life expectancy is for various stops on the metro system. And what you can see is within a short ride, you lose 7 years of life expectancy. People who live in the southwestern part of Washington can expect to live many fewer years than people who live in the Maryland or Virginia suburbs. So where you live, where we live, makes a difference to our health. Here are 2 maps of the County of Los Angeles, and I want you not to see detail. I want you to see the big picture. The map, as you can see, that's on your left shows economic hardship, and the map on the right shows obesity. And they're almost perfectly superimposable. What I want you to notice is the dark area that is approximately midway. I'll start on this screen and I'll go to the other. This neighborhood right here. Everybody see that neighborhood? I'm going to come back to it later as a test of your paying attention. All right. Often I'm asked, okay, so we can superimpose, we know poverty makes a difference, we see that there are places that have bad economics and they have bad health, so what? What can we do about that? There is across communities in this country, and certainly across parties in this country, a lot of doubt that if we change context, we change health. Well, in 1994 to 98, the Department of Housing and Urban Development did a very large experiment. They moved 4,600 poor families around. They randomly assigned, so they didn't pick, they randomly assigned people either to stay where they were or to move to a different neighborhood or to move to a neighborhood with very low rates of poverty. And then they looked to see, for the people who came from really poor neighborhoods and moved to neighborhoods without as much poverty, what happened? After 3 years, mental health for the parents who moved and for their sons improved significantly. 3 years, that's pretty quick. After 10 to 15 years, those people who moved had lower levels of obesity, they had lower levels of severe obesity, and they had lower levels of diabetes. You may know that we are becoming a nation of diabetics. The rates of diabetes in this country are astronomical. I'm a pediatrician. When I trained in pediatrics in the dark ages, we never, ever saw a child who had obesity-related diabetes. And now when I go back to the hospital where I've worked, the number of children with diabetes is extraordinary. But if we move people from neighborhoods that are poor, we don't change their income. We pick up the people and we displace. Not a great thing, but when we do, what happens? People get healthier. And the thing that was puzzling was when people looked at that time at what happened to economic opportunity. So we have poor people, we move them out, we know economics is important. You saw the maps. Poverty is associated with all kinds of bad things itself. So if we move the people, what happens to their economic state? The initial analyses from this study looked over a short period of time at what happened to earnings for people. And the answer was not much. Moving from a poor neighborhood to a not poor neighborhood doesn't change your earnings very much. But then somebody reanalyzed and looked later at the children, 20 years later. And what did they find? See that dark line in the middle? And see that that's age at the bottom? How old you were when your family moved from poverty to being poor in a wealthy neighborhood significantly impacted your lifetime earnings. If we move children early, or in other words, if children grow up in neighborhoods where there are people who aren't all poor, those children's economic future changes. And remember that pyramid? The strongest impact on health is those socioeconomic factors. Children growing up in communities that aren't completely neighborhoods of poverty makes a huge difference to their lifetime earnings, and lifetime earnings are one of the strongest predictors of health. Well, the guy who did that analysis, Raj Chetty from Harvard, said, this was an experiment. Can we find something in real life that mirrors this experiment? That is, can we find families who have moved from poor places to not so poor places, and families who have moved from not so poor places to poor places? And can we figure out what happens to them? The answer is yes. So what happens to children who grow up in poorer communities versus not so poor communities? This is an illustration of his work from the New York Times, and what he found was that the income in adulthood, which is what you're seeing on the y-axis, the income in adulthood for children who move early looks just like it did in the Moving to Opportunity study. The earlier children are exposed to good things in their neighborhoods, in their contexts, the more likely it is that those children, even if their families are poor, the more likely it is that those children will ultimately have higher incomes and move out of poverty. And in fact, if we look at one of the analyses, this is for the city of Philadelphia, which is also Philadelphia County, you see that they divided groups into poor kids who moved, average income children who moved, and rich kids who moved, and looked at boys and girls, and were able to create then an estimate of what their lifetime income would be for moving. Excuse me, their lifetime income would look like. What's the change in lifetime income on average for the move? Lifetime? Annual income for the move. And you can see that kids who grow up in family wealth in the same county tend to have their income go up, just as kids of wealthier families tend to do year after year. And kids who grow up in poor families, in poor neighborhoods, tend to see their income go down in a relative sense over time. And they then mapped every county in the country. And these maps show in red How are counties where your income goes down if you move to the county? And blue, places where your kid's income goes up if you move to the county, if you're a poor family. So here are the 6 counties in the country where it's most advantageous to move for boys. Some of you may come from those counties. Some of you may work in those counties. And here are the 6 counties where it's worst out of the 100 counties, urban counties in the country. And what you see, that for boys in this country, in urban counties, the 100 biggest urban counties, the worst place to move if you're poor is Baltimore. Raj Chetty's study came out before the incidents that have occurred in Baltimore. And when things happened in Baltimore, people started to pay attention. And conversations about what does it mean to have really poor places for really poor kids started in earnest. In other words, people began to say, context shapes life, right? You all know that. You build contexts. You build good contexts. You try to improve the opportunities for people in contexts. You are building wealth. You are building health. So here's the map, same map, the impact of county on income. This is heart disease by county in the country. This is diabetes by county in the country. They're incredibly similar, almost superimposable. I come from a foundation that supports health. We care a lot about place. Place matters fundamentally to health. The question, though, is how does place matter to health, right? What is it about place? What do you have to do? You guys want to know. How do I change the place to make people greener? How do I change the place to make people healthier? How do I change the place to improve economic opportunity? Is it all about poverty? Well, what is it about poverty? What is it about non-poverty? What is it about the place? If we could figure that out, we could build to it, right? So, what we know is education makes a difference. You guys build schools, right? Here are a series of lines. The line in the middle represents trends in mortality in this country for 40 to 64-year-old adults. And you can see the good news that between 1989 and 2007, average mortality went down. And you can see that for people who had more education, early death, essentially, went down. But what you see is mortality rates for the poor have been going up. If you're a poor adult and you don't have as much education, that's poor adults without education. There you see that top line, less than a high school diploma. What factors do you build in a high school that makes kids want to stay in that high school? What is it about the environment? Is it all the people, or is there something about the place? What are the things surrounding schools that make a difference to people staying in school and graduating? There are things about place that influence the nature of education and instruction, that make it easier for instruction, that you do, that make a difference to whether or not people will live to a ripe old age. We as a country, of course, have decided we'll invest more in health care rather than education. So over the last decade, we have reduced our average expenditures on education and increased our average expenditures for health care, even for the poor, which is not a bad thing in terms of health care, but it's not a good thing in terms of education and health. And you may say, the how with housing. We know a lot about how housing impacts health. Here is a list that shows you hazards, and in the middle it shows you health conditions, and on the far side it shows you a series of impacts. You build out those hazards. You remove those hazards. You build places that are resistant to those hazards. You promote the health of children. And the more you build to standards that promote health. And the more you build in what you do and push the industry to build things that are near transportation and don't include lead and deal with lead in the soil, you are promoting the health of children. Wide sets of indicators. So what works for health in building? Well, healthier housing improves the health of children. We have really nice documentation. Mixed income communities improves the health of people. Proximity to employment improves the health of people. Access to transit, joint use facilities, which you guys have as part of your vocabulary. I had to figure out what that meant. Available food, particularly healthy local food, improves the health. We now know from a series of experiments that the Centers for Disease Control started to fund at the time of the recession, that if we minimize the number of food deserts, places where people have to walk more than 10 minutes to get fresh food, we improve their health. And using health information in design and planning, building to health, building to solve the problem, makes a difference to health. Here's an example. How many people have heard of Green and Healthy Homes, the Green and Healthy Homes program? I have little islands of people. All right. So the Green and Healthy Homes program is one that says things that promote green, right, weatherization in homes, can be done at the same time that we go in to remove lead from homes, and at the same time that we remove the hazards that lead to children having asthma. And on the healthcare side, that's great. We get a 3-fer. But the 1-fer that matters the most in terms of healthcare expenses is asthma. Asthma costs this nation a ton. Asthma costs this nation a ton in terms of parents missing work and children missing school. And asthma is much more common in poor neighborhoods, and asthma is much more common in neighborhoods with dust, and asthma is much more common in neighborhoods where the housing stock is bad. So if we find children who come to the emergency room with asthma, and we go to their homes and we fix their homes, guess what happens? The cost of care for those children goes down. So we now have this idea. Let's pay for that success. Let's use healthcare dollars to fund housing improvement. And let's do it in a continuing, sustainable way. There's an experiment that the Robert Wood Johnson is one of the partners with in Baltimore to take 1,200 homes and fix them up, homes of children with asthma. And if the healthcare system saves money, let's take that money and pay back the developers and the builders and everybody else, and then use what's left over, because there's a lot of extra money left over, and pay for more houses so that we continue to improve the housing stock in places like Baltimore. And in Philadelphia, a hospital and the city of Philadelphia came together with community development supports and have built a multi-use facility, healthcare, library, recreation center, and park. And then we linked them all with an information system so that the doctor can prescribe physical activity at the recreation center. And the recreation center can send people to the library to learn about heart disease. And the library can send people back to the health center if someone comes in saying they have a pain here or there. Co-location of related facilities tied together by technology to promote health in the most diverse community in Philadelphia with incredibly high rates of poverty. Facility is just being completed. There's a major evaluation that will go on looking at the health of the community. But that kind of co-location took incredible design, right? Design on both the building structural side and the information technology side, and then the services side, so that everybody could seamlessly work together. This is East Lake Meadows Public Housing in Atlanta. How many people know about East Lake? A few. This is before. This is after. When they changed the environment, what happened? Same people. What happened? Crime went down, violent crime went down, employment went up, student performance in school increased, to the point where a school in the center of the East Lake community that was near the very bottom of all the elementary schools in Atlanta is now the #1 performing elementary school in the school district of Atlanta. And what was changed was housing. Working together, we can create a common goal, which is to build healthier places. You're already doing it, but what are we doing? What can philanthropy do, and how do we think about this? I want to give you a few examples, and hopefully some of these will work for you as partners to try to improve what you're doing. So we can work on policy. We fund people to think about policy. We fund people to improve planning. We fund people to change their practice, to make it healthier. We measure stuff and create ways of measuring. We help learning across sectors, and we fund all kinds of projects. So what do? How many people here have heard about health impact assessment? The National Center for Health Impact Assessment, which teaches about health impact assessment and funds people to do these assessments, which look at decision-making and say, let's use a health lens for this decision. Let's bring all the people involved in this decision around a table. Let's use real data and numbers to try to come up with an answer, but let's have those numbers be what we know this decision will do to health. Let's have health be the common denominator in our decision. That funding now, you see all the dots on the map, those are individual health impact assessments that we've funded through this site. If you're interested in health impact assessment, you can see the Pew Trust's website is our co-funder, and they have the center. I'm happy to provide connections if people would like. In the terms of planning, the New York City Regional Plan, I've been told, is the largest regional plan in the world. Every 25 years, the region comes together in all the 3 states, and they do a comprehensive plan that looks at transportation, and it looks at conservation, it looks at energy, but it's never looked at health before. This regional plan drives the regional plans for virtually every other region of the world, historically. This regional plan includes a chapter on health. How do we build health into regional planning? Because unless you guys have regional plans and municipal plans that are enabling, you have that much more trouble building healthy places. So policy and planning. How about measurement? I don't know if you know county health rankings and roadmaps. Every county in this country now has a ranking within its state that's available online at countyhealthrankings.org. The rankings are updated annually. If you need local data on health, on indicators of health, on life expectancy, on infant mortality, it's all there at the county level for every county. It has been catalytic across the country in bringing people together who didn't know their county was nearly last in the state to say, what do we do about this? This is the Philadelphia data. You can see that out of 67 counties in Pennsylvania, Philadelphia is number 67. I will say, having been the health director for Philadelphia, of the 10 easily changeable, not so easily, but changeable indicators over a short period of time, all 10 have improved in Philadelphia over the last decade. It's really nice. The ranking hasn't changed very much because Philadelphia is by far not only the poorest city of the 10 largest in the United States, but started way behind, but we're catching up. If you work in a place in this country where you lack data on what's the real state of health, County Health Rankings is available to you. The other place I would go is something called success measures, which for those of you who know NeighborWorks, success measures here in Washington, D.C. as part of NeighborWorks, it provides local instruments, questionnaires, surveys, and other things online in usable format that you can administer or people can self-administer. You can pick and choose across 19 domains of outcome. 19 domains of outcome at the local level for things that building might change. Easily available to you, and the people at Success Measures would, I think, love to work with you if you're interested in trying to evaluate the impacts of your work. Financing. The Low Impact Investment Fund has something called a social impact calculator. You can think about your project, put it into the calculator, and it will tell you in dollars what are the impacts on things like health or education, so that you can begin to, in partnership with those people who care about health and education, talk about what's going to be saved by improving this structure, this environment, this development. So policy planning, measurement, and financing. In terms of cross-sector learning, the foundation just kicked off a new program that will invite designers and architects and builders and doctors and nurses and educators together to learn about how we make a healthier nation. How do we change the culture by changing the context together? Those opportunities will come out next summer, and both individuals and places will be able to apply for teams or individual work as a national network to learn together how to make the country healthier. And finally, I come to practice. And I figure for you guys, practice is kind of important. We're funding something called the Build Healthy Places Network that provides examples, discrete, concrete examples with information about where health is being baked into or health is being gotten out of building, where places change and health improves. And we're funding the Urban Land Institute to look at healthy corridors. You guys know what unhealthy corridors are. The places in parts of this country that look like this. Some of you probably were involved at one point in constructing some of this stuff. Well, guess what? We're trying to make it better. These are places where the corridor connects the suburbs with the city. We have big box retail along the way. Nobody walks, nobody bikes, nothing good grows, and in the blocks surrounding it, we have poor kids who have nowhere to play. You see in the upper left-hand corner, Van Nuys Boulevard in Los Angeles? Who was paying attention when I pointed out on the maps that dark spot? Well, guess where Van Nuys Boulevard is? It has one of the worst health status indicators in all of Los Angeles County. We're hoping with the Urban Land Institute that we can figure out both the real estate strategy, but the redevelopment strategy to build active living, better food environments, and healthier places even along these corridors throughout the country. And finally, perhaps most exciting is we actually have a partnership with you. And what we are trying to do is to build into the standards that you all use, the LEED standards, health. LEED helps guide the industry toward climate-friendly investment. We want health-friendly investment. We think often it's the same, but there are specific things already in the guidelines, and there's more that can be done. We want to apply green building principles for market transportation to promote healthy places. Your team is sitting here in the front row. I would make them stand up, but they're very shy. If you don't know Matt and Chris and Kelly, please get to know them. We think the opportunity for partnership between health, not health care, between health and those who build green is going to be critical in terms of building a culture that's a healthy culture in this country. But we all have to do more than think big. We need to actually get up and act. And working together, we want to invite you to build the context for an enduring culture of health in this country. Thank you. Questions? We have a few minutes for questions, like 5 minutes and 5 minutes. Okay. Yes, sir. Whoop, I have to have you go to the microphone because they're recording, but please go. Yes, sir. I can't see very well.
That's
so
okay.
If I miss somebody, just wave at me.
Do you have recommendations of what we can do to do this culture of health at the local government level?
So when you say do this culture of health at the local government level.
To promote.
Sure. I think it depends on what part of the local government level you want to work with. Do you want to work with the part of local government that has to do with tax credits or planning? Do you want to work with the part of the local government that has to do with social services or community development? You want to work with the local government? I worked in Philadelphia as a deputy mayor for health and essentially social services. And for a while, I had parks, recreation, and libraries under me, as well as all the social service and other things. And what was very clear was that at many tables that were created around Philadelphia, what was missing was government. But government came to the table pretty willingly when people made the value proposition. We could save money by single stream recycling, right? We could have lower expenditures for our workforce if they were healthier, since everybody lived within Philadelphia County. We could improve our tourism if we took tobacco out of restaurants and bars. We could, and there's a big long list. There are people who could help you if you have a particular issue with local government. There are people and sites, I'm happy to provide you actually with contacts of people who are moving even irascible, impossible governments around this country to be somewhat healthier. This is a movement that's going to take a generation at least. So even if you move a government by a centimeter, that's a centimeter better than going in the wrong direction. I hope that helps, and I would be literally happy to provide you with suggestions and contacts. Yes?
Thank you so much for this presentation. First question. I used to live in Washington, D.C. I lived right near housing projects, and it was such a shock to come from a college, come to Washington, D.C., be excited, and then see people housed basically in these horrible environments. And I always felt like, because people would say, what can we do to help? And is it schools? Is it jobs? The biggest thing that was always lacking for me was hope. I couldn't get people who were in those projects to kind of have hope to go up. Now I live in Grand Rapids, Michigan. Love Steelcase, amazing, amazing company. But the history of Grand Rapids, like many cities, has a big black eye where they redlined the city and they said, if you live in this area, we're not gonna give you money for a house. And some of that's coming to light, but of course those areas are still the areas where people predominantly of color are living and are very poor. And I guess my question is, thank you for listening, is how do we get people who are predominantly people of privilege, white people of wealth, who may love the cities where they live, and may not even be aware of these pockets of just people living in these terrible conditions? How do we get them passionate to really care?
So I would answer that by saying a couple of things. One is, I don't know if you get industry that is really terrible in polluting to change its ways voluntarily. I think you build political will among everybody else, and they come to industry. So the question is, how do we get people who are in communities that don't have hope? And how do we build better places for them so they're hopeful? The experience in Atlanta says to me we can do that. There are people building in Minneapolis, and in New York, and in Philadelphia, and in around the country. Let's build in Grand Rapids. Let's find out how to get the financing there, and let's figure out how to get people around a table so we're not doing it to those folks, but we're doing it with those folks. And let's build a healthier Grand Rapids, right? You know how to build, I don't. I can show you examples around the country where people are doing it and it's improving health. But let's bring the best examples in your mind and passion to Grand Rapids, and once Grand Rapids is better, let's have other people be jealous of Grand Rapids and build their stuff, and then go and say, let's make sure everybody gets to mix and do whatever else is necessary. But building better, right, for people, with people, building better environments, figuring out the financing, figuring out what to do with the schools and so forth, I think can happen with ingredients we have currently and a lot of public will. But we need voices and we need people who know how to do it, because I'm asked all the time, so here you have $100 million who went to such and such, and look, they just did nothing with it. We need people who have good experience and goodwill and good examples and ties to do what needs to happen.
Hey, thanks, Doctor. As an engineer, and I have my background show in energy sectors to the client, the result, how to save energy, but I show him a statistic number. This is what you paid, and this is what the cost avoiding. You are the right person to ask you honest questions. You show one of the slides how our government spending too much money toward healthcare, and we are going down to educations. And you get next year, our new election, now they're calling to call Obamacare. From your perspective, is Obamacare expensive? Is it the right directions? What the heck is going on? So you give me the right answer.
Okay, so talk about a loaded question in Washington. At the foundation, we like Obamacare. Obamacare has expanded health insurance for more than 10 million Americans. Having coverage is critical to having access to basic health promoting services. And we know that the #1 reason for personal bankruptcy in this country is unpaid health expenditures. So if nothing else, what Obamacare helps to do is it helps people become poor because of their health. And it supports people who are poor and unhealthy to at least have basic access there. But the other thing Obamacare does is it tries, and we'll see how successful, it tries to change the way we think about the cost of health, from the cost of health for healthcare to investing in health in a more fundamental way. And it provides a series of incentives, both for hospitals to get out in their communities and start doing good things, and for insurers and hospitals and other healthcare providers to come together to think about who the partners need to be to make healthier people, as opposed to healthcare-rich people. So I think the headset in Obamacare is right. We could debate on and on and on about specific provisions, but the overall vision that people shouldn't become bankrupt because of healthcare expenditures, and we need to refocus the system on health, not just healthcare, I think those are very right-headed, good changes that the law promotes. Thank you all very much.